our presenter for the day, Mary Wood.
Good afternoon, everybody, and thanks so much for joining us. Today's presentation is really a compilation of many of the questions that you asked at the end of our last presentation 2 weeks ago. And so what we tried to do is take some of the topics. We couldn't include them all because we got several hundred questions actually. So we put some of them together in a packet today, and we'd like to go over those questions with you. We also want you to know that we have saved the rest of them. Our next presentation is actually going to be on alien emergency medical, and that came directly from many of the questions that individuals had last week. And our future webinar will be on income because there were several questions about income. So as we go through the presentation today, at the end of each section, we will give an opportunity for you to be asking questions about the section we just went over. So please feel free to type in questions as we go along, and as time permits, we'll try to get to as many of those as we can. So out of the questions that you submitted 2 weeks ago, we've gone ahead and put together really 4 sections, if you will. One is on application processing. One is on Medicare and what do we do with individuals who are receiving Medicare. Another section is on the renewal process. And then finally we have a section that will go over on residency. As Karen alluded to at the end of the presentation, we'll show again our links and where you can go to get not only this presentation but other information that we have up on the site. So we'll get started then. And the first group of questions that folks had to do with the application process. And so we'll go ahead and start with question number 1. So the question says, if we think someone is classic Medicaid eligible, should we apply in Washington Connection or the Health Plan Finder web portal? And this really was kind of a common theme across many questions that we received. And so basically, if everyone is over 65 years of age or entitled to Medicare, the best place that they should apply for health care coverage is really Washington Connection if they wish to apply online. We are working right now with partners and trying to beef up some of the help questions on Washington Connection so that hopefully we'll be able to direct families to the best place for them to apply for coverage. But if someone is over 65 or if everyone in the household is entitled to Medicare, the best place is to apply in Washington Connection. There's one exemption to that, and that is for immigrants, individuals who are not going to be eligible for Medicare. They can come and apply through the Health Plan Finder and be determined eligible not for Medicaid. If they're legally residing here, we can look at them for the qualified health plans. So, turn to the next question. So the next question was a permanent resident who's over 65 years of age is looking to apply for health care coverage but has not yet met their 5-year bar. Where do they need to apply for coverage? Is it at DSHS, Washington Connection, or the Health Plan Finder? And in this example, there's really kind of 2 answers for that. The first, if they are going to be needing or wanting or seeking ongoing health care coverage, and they're legally residing here in the country but are still in their 5-year bar, they should apply through the Health Plan Finder. Because they're, depending on what their income is, they may certainly be eligible for tax credits or a qualified health plan, even though due to their immigration status, they're not eligible at this time for Medicaid. But also, as we've talked about, we do have a program called AEM that does provide emergent coverage and care for individuals who are over age 65. So if you have an individual who is needing alien emergency coverage and they may not be legally residing here but over the age of 65, the best place to apply would really be through Washington Connection, and we could look at AEM through the classic Medicaid programs for them. Another question we had from an individual is, do clients who are applying for DSHS long-term care services need to apply through Washington Connection or Health Plan Finder? And the answer kind of goes back to kind of the basic premise between the two online applications. If someone is over the age of 65 or entitled to Medicare, they would apply through Washington Connection if they were needing or wanting long-term care services. If someone is under the age of 65 and not entitled to Medicare, they might want to apply through the Health Plan Finder, because depending on what their income is, they may certainly be eligible for coverage under the new adult group or the expanded Medicaid group for adults. So once again, it kind of depends on their age as to where would be the best place to apply. The next question is, how do we handle homeless youth no longer residing in a family household who are under the age of 18 and want to apply for health coverage? And is there a workaround for assisters to be able to complete the application without directing them to the Health Plan Finder Customer Service Center? And at this time, there is no workaround. Minors must still be referred. Anyone under 18 wanting to apply online needs to be referred through the Health Plan Finder Customer Service Center. The Healthcare Authority is working with some of our community advocates and partners, especially those that are working with homeless teams. And we're in the process of developing another avenue, if you will, for folks to refer individuals to. And that avenue will be having them actually contact a worker here at the Healthcare Authority. So going forward, agencies that are working with homeless youth will really have two places where they can direct their phone calls or direct their applications. One will be the Health Benefit Exchange Customer Service Center, but we're also going to be providing contact information for here directly at the Healthcare Authority. So watch, we'll be sending that out. I was hoping to have it done before today, and I didn't get it completed. So we'll be sending it out through our listservs, both with HBE to the in-person assisters, through our HCA area reps, and through WACOMO. So I think we'll have something out by the end of next week. If you haven't heard by then, if you send something to the Ask Maggie box, we'll be sure that you get the information. Another application question was, is there a way to create an account after the application has already been processed? Can the previous application be linked up to your account? And the answer to that is yes. The individual can create a user account after their application has already been processed. Once they've created the initial account and they enter their demographic information, the two will be linked in Health Plan Finder. So this is true. There are many families who, for whatever reason, an account was not created at the time that they came in and applied for Health Plan Finder, or perhaps an IPA did an entry of an application, or they sent their application into the Health Benefit Exchange and it was data entered and they didn't have an opportunity to create their account. They can go in after their application has been created and create an account, and it should link up to their current case. The next question then is, what is the turnaround in Health Plan Finder for verifying pending documents that have been uploaded to the client's dashboard? For Medicaid, what we do is, I'm not going to give you a specific time on how soon we would go in to look at those documents, but if we have pended a case for Medicaid, we're always going to send what we call a 10-day request letter out to a family for any information that we might need. And before we process that 10-day request, we'll set like a reminder for us to go back and see if the information's in. Once we've set that reminder, we're always going to check in Health Plan Finder as well as in our case record to see if that information has been received and to process it. What is the turnaround time in Health Plan Finder on verifying pending documents? And this is for tax credit or on the health benefit exchange side. And we got this information from our partners at the Health Benefit Exchange. They state that they're reviewing these documents daily, and as with Medicaid, no adverse action is taken to an individual's account in the interim. So while that's sitting there, there won't be an adverse action taken. HBE also wanted us to note that it's also important that although the individual is conditionally eligible while they're waiting for their documents to be worked, they may still continue to move forward in selecting and enrolling in a qualified health plan. And as long as the individual submits the required documents within the 90-day conditional period and the documentation provides sufficient proof, the individual will have no negative action taken on their case. We had a question on the KO1 program. And for those of you who may not be familiar with what KO1 stands for, that's an institutional program for children and families, and it's for individuals who maybe are in a facility such as a hospital or a nursing home for longer than 30 days. And sometimes we look at the KO1 program for that. So the question is it true that the KO1 application process has changed to check eligibility for different programs first and then KO1? And the answer for that is yes. If for example, we process an application for a child and they have their eligibility determined for Apple Health for Kids, we're going to go ahead and leave them on that program because they'll receive the same coverage that they would get if we move them to KO1. So we'll look at that program first. If they're not found eligible for Apple Health for Kids, then the application would follow the current KO1 process. And just as a note, if anyone needs access or has not, we sent that process out, but if you happen not to be on one of the listservs on that and you work with families or in particular children that may be institutionalized, if you send something to the Ask Maggie box, we'll be sure that you get a copy of that. Application process then, the next one, Karen. Question, does also, which is the Aging and Long-Term Support Administration's website, direct all applicants for Home and Community Services to apply at both Health Plan Finder and Washington Connection, even clients over 65? 10 letters are sent to elderly clients to complete both. And is this correct? And it was correct at the time that we started implementation, and that is what is currently on the website. We've been working with ALSA as well as DSHS and some of our community partners to figure out a more streamlined way for those individuals wanting or needing classic Medicaid to apply. And we'll be sharing more of that as we go forward. So as we mentioned earlier, if someone is over 65 and on Medicare and they're wanting long-term care services, if they go directly into Washington Connection and apply for those, they'll be just fine. Their application will be processed. I have a couple who is married filing jointly, but only one of them needs health plan because the other spouse has coverage through their employer. Well, why will Health Plan Finder not allow the other person to receive coverage since I indicated only one needs the health plan coverage? And what we think that this is commonly occurring is when an individual has indicated that they're applying for myself and others on the first screen, But the Health Plan Finder has screened validations to make sure that if this option is selected, there must be at least one individual in addition to the primary applicant who's seeking coverage. So I think the first thing that we'd want to say is make sure that if you've checked myself and others that that's really what you want, and that in this case, if the primary applicant was the one who had insurance coverage, they would want to be just applying for others, not themselves. So that's been kind of a common mistake. The other issue may have to deal with the fact of minimal essential coverage, because under the health benefit exchange, if you recall, if someone has employer insurance, one of the things that has to be looked at is, will that coverage be allowed for dependents? And then if so, does it meet the definition of minimal essential coverage? In conjunction with this question, we're asked several times whether receipt of other health coverage makes an individual ineligible for Medicaid, and especially no-cost Medicaid. And the answer to that is no. Individuals have always been able to have other coverage and be eligible for Medicaid, and that continues. The only program where we have to look at coverage is our CHIP program, which is our premium program for children over the 212% of the federal poverty level. So if they have other insurance, they may not be eligible for coverage, but everyone on our Medicaid program can receive Medicaid even if they have other insurance. The next question on applications then, when working with adults with mental illness who are currently or never have received Medicaid, is it better to go to Washington Connections or Health Plan Finder? And again, those over 65 are entitled to Medicare. The best place would probably be Washington Connections. But for any individual who is under age 65 and not entitled to Medicare, you would want to go through the Health Plan Finder. Again, the only exemption to that over 65 rule for Washington Connection would be if I was an immigrant who was over 65 and legally residing here, then I would want to come through and look through Health Plan Finder because I might be able to get coverage through tax credits or QHP. The next questions on application has to do, says, please state the classic Medicaid option and how Health Plan Finder will behave if there's an individual who qualifies for the classic Medicaid program but begins their application through the Health Plan Finder web portal. So an example is if a 68-year-old applies in Health Plan Finder, they won't be eligible for the new adult group, for family, for pregnant women or children. And if they're entitled to Medicare, they would not be eligible for tax credits. They will be referred to Washington Connection to complete their application after they've entered their data into Health Plan Finder. There's also a couple of early outs where individuals can get into Health Plan Finder, and they've got some early opt-outs that if they feel that someone meets both those criteria, they'll allow them to click on a link and go to Washington Connection. But if they get all the way through the application, then what will happen is that we'll kind of be given two options. One, they'll be able to click on a link which would take them directly to Washington Connection. And if they choose not to do that, perhaps they've been online long enough and they choose not to do that, then in overnight batch, the system is automatically going to send them out a letter with the supplemental questions from the healthcare authority that would be asking about their resources. And at that point, they'll be asked to return that information in to have their application processed for classic Medicaid. The last question that we have here in our application section happens to be about, please discuss the Spenddown Program and how assisters can help clients who are unable to pay their Spenddown before they can receive access. And unfortunately, not a lot has changed in regards to our Spenddown programs. The rules surrounding Spenddown and what can be used to meet that are the same as they were prior to implementation in October. I would say one good piece of news in regards to the Spenddown program is that if you're working with an individual who's under 65 and who may be disabled and might even be receiving a Social Security disability payment, but who is not entitled yet to Medicare because perhaps they're waiting their 2-year wait period, if their income is under 138, they would be eligible for coverage in the new adult group. And as you know, the coverage under the new adult group is really a much better benefit package than the medically needy program. And it also offers the possibility, if I have income, you know, for the new adult group, it's about at $1,250 a month. If my income is below that, I'm going to be covered without having to meet Spenddown. And we were able earlier this year to move over about 2,600 individuals who fell into this category. But as you come across individuals that you're working with, it would be really helpful for you to keep this in mind and to encourage them to apply through the new adult group. So with that, I'm going to stop for just a moment. That's kind of the end of the questions that we had under the application section. And I'll see, Karen, I'm looking at the time here. I probably can take maybe 1 or 2 questions. Okay.
All right. So first question. We had quite a few questions about the KO1 program.
And is it that they haven't had the process?
So the first one is just what does KO1 stand for and or what type of program is it?
Yeah, KO1, it means it's just our institutional program really for families and children, and primarily who we see in this, although it sometimes can be individuals who are needing nursing home services, but quite often the vast majority of individuals on our KO1 program are children, often who've been hospitalized and whose hospital stay is anticipated to last longer than 30 days. And these children then would receive, we can follow, when we use this program, we can follow institutional rules, which means I may have a child whose parents would have income above the Apple Health for Kids Medicaid standard. But if a child meets that definition of institutional, they're going to be in the facility for longer than 30 days. We can base the child's eligibility on their income. And so we don't have to consider parents' income, bottom line. And it can make individuals eligible for coverage. Karen, maybe one more, and then we'll come back to them if we can get through our material.
Where do applicants apply for the new adult program? Health Plan Finder or Washington Connection?
They're going to apply through the Health Plan Finder. So if you're going into Washington Connection and you're looking for coverage in the new adult group, it'll have some help that will direct you to the right spot, but you really need to start in Health Plan Finder. That'll be the quickest way.
Okay, last question. Where is a KO1 application processed? Through Health Plan Finder or Washington Connection?
Good question. You can come through the either door. If you come through the Health Plan Finder door at the end of the process where we look at those referral questions, it will send you over to DSHS, or you can just directly send in a paper application directly to DSHS. And it's really ALSA, Aging and Long-Term Care Services, that actually process those applications at DSHS. So Karen and I will figure out a way between us to, she's looking mean at me right now, but we'll figure out a way to resend out or to put up this KO1 process, because it looks like there's a lot of questions on that. So I'll make sure we get this maybe up on our training and educational site, Karen, just because there's a lot of questions. On the next section of questions we had to do with Medicare. And so we kind of put them in together into this section here. And the first question is, I'd like to know about individuals who are dual eligible for Medicare and Medicaid. One of my clients was denied Medicaid because he had Medicare, but I thought he could qualify as dual eligible. And the only Medicaid program that a client who is dually eligible, meaning they're getting Medicare and they're wanting to apply for Medicaid, the only Medicaid program they cannot receive is the new adult group. So if you went into Health Plan Finder and were looking for coverage in the new adult group and you had Medicare, you would be denied for that Medicaid program. But you would be eligible to be considered for one of our classic Medicaid programs for either being age blind or disabled. And those are our existing programs that we've had in place, and you would be able to get coverage through those. Okay. The next question then is a client eligible for Washington Apple Health when they currently have Medicare? And yes, remember that when we talk about Washington Apple Health, it's really a new brand name that we're rolling out that really covers all Medicaid programs here in Washington State. So you can be on our classic Medicaid programs and be receiving Washington Apple Health as well. As I shared previously, the only Medicaid program where a client would not be eligible for Medicaid if they have Medicare is the new adult group. So can a person who is disabled and has Part B drop their Medicare Part B coverage and apply for Medicaid? And if the answer is, can the individual drop their Medicare coverage and then apply to receive the new adult group, the answer is no on that. The ruling for the new adult group is whether you're entitled to receive Medicare. So if you're entitled to receive it, you can't be in the new adult group. And if you apply for Medicaid in general, even classic Medicaid, if you're entitled to Part B, we're going to have you follow through and get that coverage. And if you're on Medicaid, we'll be able to help you with that, the cost of that Part B coverage in our classic program. The next question is there a workaround for those that are age 65 or older but not Medicare eligible? The Health Plan Finder system seems to stop the application from moving forward even though they're not eligible for Medicare. So on the Medicaid side, is if they can receive tax credits if they're 65 and older and not eligible for Medicare, the answer is yes. And Health Plan Finder should not be stopping those applications from moving forward. And if they are, then folks need to either contact their lead orgs or their area reps or call the HBE call center to get that corrected. The Health Benefit Exchange has commented on this for us today, and they remind us, as I talked about earlier, that there is an early out option if someone has Medicare to be transferred into Washington Connection. The individual is not required to accept that transfer information, though, so they can go all the way through as we talked about, and at the end of it, their application will be, or their referral will be sent out for classic Medicaid. Next question, Karen. I have a few applicants that were denied for Apple Health, and Health Plan stated they had Medicare, but in fact they did not have Medicare. And has that issue been resolved? And yes, we believe it has. A system fix went in to Health Plan Finder in January that should have fixed this issue. So I would ask anyone on the phone is, as you're helping individuals, if you see someone who's denied for the new adult group and they're not receiving Medicare, but the system's giving them that denial, we would want to hear about that. So please let one of your area reps know about that if that happens to someone you're helping. So I think that was our last Medicare question. Karen, do we have a couple questions maybe that we could take on Medicare?
Let's see. Well, we have a Spenddown question. So if a patient's on a spend down but would qualify for Washington National Health adult coverage, should we rescreen them?
Yes, we should. So what we should do on those cases, we tried to catch as many of those as we could, and we're also going to continue to run a monthly report here just to catch anyone who maybe has gotten into spend down and shouldn't have been. But yes, if you have one of those, I would go in and go ahead and get them entered. And today we're getting close to the last day of the month, so I would get it entered if you want today, and we would be able to even go and backdate that back to January if you marked that you wanted retro coverage on that. So we should be able, if the individual is eligible for new adult, we should be able to cover them back to January 1.
Let's see. Please clarify that folks who have not met their spend down could also qualify for a QHP with subsidies if they do not have Medicare.
That is correct. There are lots of folks, not lots, but there are folks who are on spend down who don't have Medicare. And again, if they don't have Medicare and they're over the income standard for the new adult group, they would go into tax credits, and that many times will be a better option for them. Okay, I think we'll move forward, you guys, and go into the renewal section. And our first question on renewals then is, what if it's March 1st and the client let their coverage lapse past the end of their certification period, which would have been February 28th? Would they now be a new applicant for Apple Health, or does my Renew My Apple Health link through Health Plan Finder homepage remain an option? And does it show up on the individual's dashboard? And we're going to kind of ask you guys for a little help on this one. It's our understanding that it does remain on their Renew My Coverage link, and that it will display there for a 90-day period of time. So again, if someone out there is working with individuals and they're seeing anything different than that, it would be really helpful if you were to follow up with your area reps. But we believe that it should be showing on that. The next question was, how come in many renewal cases Health Plan Finder shows the current DSHS coverage ending on 1/31 and the Apple Health coverage not beginning until 3/1? Is there no February coverage? And this actually showed up as an issue, kind of one that we weren't expecting when we extended renewals. Those on the phone might know that we, for the months of November, December, and January, we extended families' renewals for 1 month to give them an opportunity to complete their renewal. And when we did that for families, and then they went in and completed their renewal, they would see it appeared not in the payment system. Provider 1 is just fine, and the claims were just fine, but it looked like on their reward letters that they were missing a month of coverage. So in this example, if we had extended someone's coverage, let's say, I'll give you an example, not this because we're not doing it for February, but if we extended January's coverage to February 28th, and someone came in the month of February and completed their renewal online, their approval letter would have said March 1st, and that was confusing for families. And the reason it said that is they had coverage in ACEs through February 28th. So we'll talk about in a minute, we're no longer extending renewal, so we should see this issue go away, but that was some confusion for families. The next question then is, Renew My Link coverage. Would we use this link when we are adding an adult member of the household who wants coverage and the children are the only ones active, or would we need to submit a new application? And you can actually use this link. So if a family is coming in and it happens to be during the period when their child's Apple Health for Kids is up for renewal, the link can be used to add a new adult member to the existing application. you would actually go to the About You screen, and you would change the answer there. It says, who are you applying for? You would change it to myself and others, and that would allow you to apply for the primary applicant, which in most cases is going to be the parent or the adult. And then on the other household member or the tax dependent screen, you're going to click that you want to edit that, and for each household member that you're wanting to apply for coverage on, you're just going to want to make sure that it's marked yes, that you are applying for health care coverage for that person. And when you do that, you should be able to complete the child's renewal and add the parents, and if they're eligible for tax credits, they'll go on tax credits. If they're eligible for QHP, they'll go over to the qualified health plan. So the next question then is, how do you complete a renewal when no one in the household has a valid SSN? Is the Renew My Coverage link an option? And can I pass the SSN screen to complete my renewal? You really can pass the SSN screen to complete your renewal where I think, so if I was an individual going in without a Social Security number, I can pass that SSN requirement. Where families are running into difficulties is that when the ID proofing screen comes up, if it is an individual who is in the country fairly recently, they may have little or no financial history, and so when they go to do the ID proofing, there's no data for them. And that's really what's holding families up. So when an account worker, when they go in, they're having a difficult time linking up with a family who may fall into that circumstance because they can't link without a Social Security number. So in those cases, we're asking the IPAs if they can contact the Healthcare Authority or the Health Benefit Exchange Customer Service Center, then we can go ahead and link them up, and they should be able to help the families through that process. So the next one, if a family turns in one of the methods in the renewal reminder letter stating they want to maintain their coverage, will their renewal automatically be for 1 year? And the answer to that is no. The process on that, and just for clarity so everyone's aware, even though we're not extending renewals for February, if families haven't completed them, we are sending a letter to every family that didn't get their renewal completed, and we're giving them the option to contact the Healthcare Authority either by email, by telephone, or by returning off the bottom of the letter we send them in a postage-paid envelope. If they return that information to us, we are going to reinstate their benefits. The first step that the meds worker is going to do is they're going to try to reach the family by phone so they can complete the renewal all at one time. If they can't reach the family by phone, they're going to enter the last known information that's in ACEs and reinstate their benefits in Health Plan Finder. And then they're going to send a letter to the family asking them, and the two things we're really going to need from the family is what is their attested income and what are their tax filing statuses. So we sent a form along with the letter, and we're asking them to either complete and return that form or give us a call and give us the information over the phone. Once we get that information, then their application will be fully certified for a year. If the family, for whatever reason, does not return that information to us, their case then will be closed out. So hopefully that helps on that process. For a renewal, how do you search by primary applicant name? There's really a couple of ways to do that. By the primary applicant can be found by using the first and last name and date of birth, or you can also search by an SSN. If the client does not have an SSN and has two last names, it's really best to search by using the first the first of the two last names along with the date of birth. So example, if you were using my name and if I had a hyphenated name of Wood Pitt, then what you would want to do is search by Mary Wood plus my date of birth. And it seems like that's been more successful for folks. On the renewal process then, it also, someone asked, is the certification period for renewal 6 months? And no, the answer is for all Maggie households, so that's for family, children, pregnant women, and our new expanded adult group, the certification period is for 12 months. So that, Karen, that kind of finished the renewal questions. Are there any kind of a common theme of questions there?
Okay, let's see. Renewal. As of Tuesday the 25th, we were seeing new Medicaid eligible applicants showing up with an April 1st start date. We think that it should have been a February 1st start date.
If that's happening, I think that's something you need to report. I have not heard of that. So if you're seeing that, I'd like it turned in because we're looking at, unless they had a renewal extended, and the renewal would have just been extended through February 28th. So what I would have expected is for that to have been there 3/1. So if you're seeing a March date, you're probably okay. If you're seeing an April date, then I'm concerned because we only extended renewals through February. So it should have only been February, and we should have seen a case with 3/1. So I would say that might be a good one. You can certainly forward that to your area rep, and we'll take a look.
Okay. What if someone ages out of Apple Health for Kids? Do they renew or apply for the new adult group?
They're actually going to get a renewal in the mail that tells them they've aged out of Apple Health. Oftentimes when they're on the Apple Health program, they're covered under their parents. So they'll be sent a renewal and asked to come into Health Plan Finder and establish their case as them being the head of household. And then depending on what their income is, they'll either be eligible for the new adult or perhaps for tax credits or QHP. But they're sent a renewal actually 60 days prior to their birthday.
What if you have a disabled adult who is on Medicare and they are renewing their dependents coverage on for Washington Apple Health in Health Plan Finder? Can you also then apply for Medicaid secondary for them as well? Disabled and have Medicare.
So where those applications, I think I understand the question, where they're going to be processed is really at DSHS through our old ACES system. So while we can certainly refer you over if you come in through Health Plan Finder, you will receive a referral and either ask for additional paperwork or ask to click on the link and go in and complete that application in Washington Connection. Karen, maybe I'm looking at the clock. Maybe we'll start residency just so we make sure we can get through it, and then if we have time, we'll come back.
Sounds good.
So on residency, then we had several questions, and a couple of themes came through on that we wanted to go through. So the first question was, what if a person enters Washington State to go to drug and alcohol treatment and plans on residing here after they finish their treatment? Are they eligible for Washington medical coverage? And we just think it's important to note for everyone that the residency rules have not changed under the Affordable Care Act. So if the only reason, and I kind of underscore only, if the only reason an individual enters the state is to receive medical coverage, then they're not eligible for Medicaid. That's been a longstanding rule, and it was true in the past, and it's true today. However, if an individual enters Washington State and they plan to make Washington State their residence, then they would be eligible to receive coverage here in Washington. So in responding to the question above, the question would have to be, individual would have to know, do they plan on living here? If the answer is yes, I'm going to move to Washington, and then I'm going to receive care, then they're certainly a resident at that point. If a client is in Washington for long-term Indian boarding school type residency, with the possibility of several years, are they eligible for Washington residency? Again, if the only intent why someone is in Washington, be it Indian boarding school or U of W, any college, if the only reason they're here is to attend school and they do not intend to be a resident or to make Washington their residence, then they're not eligible for coverage. Again, the next one is about a college student who resides with their parents in Washington but are attending school out of state during the school year, and the same thing applies. If they maintain Washington as their residence, then they are eligible to apply through Washington or for Washington Health Plan Finder for coverage. The next residency question is, what happens if a person who comes to Washington has ended up in the hospital and is not going to be returning to their original state due to their medical condition for an indefinite period of time, including possibly placement for rehab and further medical treatment? And we've got this slide and the next slide really talks about intent, especially for individuals that are going to be institutionalized here, either in a hospital or a long-term kind of care setting. In this first one, it really depends on whether the individual is capable of declaring their intent. So if the individual is capable of declaring their intent, and their intent is that they plan to, that they're going to live here in Washington State, then they're a resident and we'd be able to do coverage. On the next slide, it's the same kind of example. However, this is someone who is now on a ventilator, and the family is stating that this patient will be residing in Washington to recover, and the hospital staff doesn't know the amount of time they'll be needing care. Again, it depends on whether they're capable of declaring their intent. In this case, let's assume they're not capable of that, and then what we do is where the person is physically residing then becomes their residence for the state. So in this example, they would be a resident of Washington as well. Okay. The next question, if someone currently receives Oregon Medicaid but moves to Washington State and would like to apply for medical, is there anything they must do in Oregon prior to applying through Health Plan Finder? And would there be an error related to this if they still have Oregon ID, such as ID proofing issues? What an individual needs to do as they move from state to state is Medicaid is state specific. So prior to leaving that state, they need to close out or have someone close out on their behalf their Medicaid case, and then they would be able to apply here in Washington. Let me see what else. Yeah, so they can receive it. The other thing I wanted to mention, because it's seen by the question there, is that there is no period of time or document that you have to receive to become a Washington resident. It is your intent that you're going to reside here and make Washington your home. So you don't need to have your ID changed to be able to apply for Washington Medicaid, and ID proofing should not stop you in that. Okay? What happens when parents what happens when patients that are currently living in Washington State but are moving out of state the last week of March? What's going to happen to their Health Plan Finder account? I think what folks need to realize is they need to, as always, if they're going to be leaving the state of Washington and no longer be a resident, they need to have their case closed. And they can do that a couple of ways. They can go in and terminate their case themselves by marking that they're no longer a Washington resident, or they can call and have the call center do that as well for them on their behalf, or they can send something in writing to us. Either way. Okay? For individuals who move to Washington State and apply for Medicaid, how long does it take for the Health Plan Finder to acknowledge that they're a Washington resident? And this is the one that I was kind of alluding to earlier. It really is the individual self-attesting There is no time limit like 30 days or that you have to get a Washington ID card. It becomes immediate. Next question, Karen. I have a client who travels back and forth between Washington and California. Will they be eligible for coverage in Washington? Some of these residency questions are really very unique, but I'll try to take this one on. If someone truly just has 2 homes or 2 places and they're moving back and forth between California and Washington, then it really will be the state in which they spend the majority of their time during that year, would be their state of residence, if there wasn't a particular reason why they were doing that. So I'm just assuming they're moving back and forth and they have a place they live in both spots, then it would be where they live the majority of the time. Okay. We're looking at here that Karen is nodding her head at me that we're just about over time, so we probably don't have time to do Q&As on the residency. So what I want to put up here on the screen then is just, again, our contact information. We have the call center referral list. So if you're not familiar where to direct a call, this should be able to help you on where to direct.
And we'll show a link at the end in just a minute.
And then we'll have a link. We also put up the area reps that are divided by county. And so you might have heard me several times today referring to the area reps. And if you have a question, these are the folks that you can call or email, and we'll have a link to that as well.
Right here.
And then here's the link to all of those. And earlier there were a lot of questions about the KO1 program and how to apply and refer. And so under that second link there, the training and education one, we will probably by Monday, can we promise by Monday, Karen? By Monday, we will go ahead and post what we have here, which is kind of an application process or a step-by-step, if you will, for KO1. And it'll be there and ready for anyone to view on that. Again, if you have questions about that, you can always email your area rep for further clarification if you have a question on that. I wanted to remind everybody that on the March 13th will be our next webinar. It's going to focus on Alien Emergent Medical Program, and we're going to admit right now up front that it's not working as well as we want, and we're working between now and then to enhance access and be able to make it easier for folks to get through the Alien Emergency Medical Program. So we'll have that information for you on the 13th. And tied in there nicely with that is citizenship and immigration. So we're going to take some of the questions that you had in your previous webinar on citizenship and immigration and work those in with the AEM presentation. So if you know someone who has a particular interest to that, especially if you're from a hospital or a facility like that and you want to have staff listen to that who work with patients, this would be a good one for them to go to. Registration announcement for this was sent on Wednesday, just last Wednesday. So please sign up for that if you're interested in that.